Welcome to the Deep Dive. We're here to cut through the noise and get straight to what matters. Today, our mission is all about the Ferritin blood test. It's a simple test, really, but tells you a lot about your body's iron. We've been looking at sources, including info from Blood Test UK, specifically checking out services and success stories down in Swansea.
Exactly. And knowing your iron status, which Ferritin measures, well, it's just a crucial shortcut to managing your energy, your overall health, really. You see, ferritin is essentially your body's savings account for iron. And iron is, fundamental. It helps your blood carry oxygen everywhere. Super important.
Okay, right, a savings account. So let's unpack that. The great thing about this test seems to be it flags problems on both sides, like too little or too much.
That's spot on. If the savings account is low ferritin, that's usually a sign of anemia.
Yeah.
Basically, not enough iron means your blood can't carry oxygen properly, so you feel tired, weak, generally run down. That chronic fatigue people talk about.
Makes sense. But what at the other end? That sounds maybe less obvious. High ferritin.
Yeah, and that's where it gets really interesting and potentially serious. High ferritin can point towards conditions like hemochromatosis, often hereditary. Unlike low iron making you tired, too much iron is actually, toxic over time. If it's not caught, that extra iron builds up. Think of it like internal rust on your organ's liver, heart. Not good. Early detection here isn't just about feeling a bit better. It can literally prevent major organ damage down the line.
Wow, okay. That really puts it in perspective. And the test itself is pretty straightforward, right?
Oh yeah, very simple. Just a quick blood draw.
And based on what we saw, especially looking at the Blood Test UK info for Swansea, results seem pretty quick too, usually just a few days.
That's right. Quick turnaround. Which is vital considering the stakes we just talked about.
Right.
And those reports, particularly the ones focusing on Swansea, really highlight the value. Real people, real results.
Yeah, we saw some compelling examples. There was a 45-year-old woman in Swansea, just constantly tired, chronic fatigue for years. Turns out, low ferritin, started on iron supplements, and apparently her energy just came right back. Huge difference.
And then the flip side, a 60-year-old man presenting with just general joint pain, nothing specific. His ferritin test, really high. Flagged potential hemochromatosis. He started treatment, which involves removing blood regularly, called phlebotomy, to lower the iron load. And his joint health, overall health, significantly improved.
All right, phlebotomy, okay. There was even a case with a young athlete, wasn't there? Feeling sluggish, performance dropping off.
Low iron was the culprit again. Simple fix with diet changes and supplements, and their performance rebounded.
So these examples really drive it home. Getting tested early, finding these things out, it can stop small issues becoming, big chronic problems.
Definitely. It's proactive health in action.
So if you're listening, maybe in the Swansea area or anywhere really, how easy is it to get this test?
Well, access seems pretty good looking at the Swansea model. You've got NHS options like through the Swansea Bay University Health Board. Then there are private GPs, clinics, and even some local pharmacies are starting to offer these kinds of tests. So quite accessible.
Okay. And if you do decide to get the test, anything you need to do beforehand? Preparation.
Yeah, a couple of key things for accuracy. Generally, best to avoid iron supplements for about 24 hours before the test. And sometimes a fast is recommended, maybe 8 hours or so. Just ensures the result reflects your stored iron, not just the iron from your last meal.
Good tips. And costs. NHS is usually free if your doctor refers you, I assume.
That's generally the case, yes, with a clinical need. Privately, you're probably looking at somewhere between, say, 50 pounds and 100 pounds, which, when you think about the potential long-term costs of untreated anemia or iron overload, it's actually very cost-effective, preventative medicine.
Makes sense. So testing is one part, but lifestyle, diet, that plays a role too, right? The Blood Test UK info touched on this.
Absolutely crucial. Regular testing, maybe yearly, depending on your risk, is smart. But what you do every day matters just as much. Eating iron-rich foods, obviously. But here's a key thing, vitamin C. Vitamin C helps your body actually absorb the iron from plant-based foods much more effectively. It sort of unlocks it for your body to use.
Ah, interesting. The vitamin C connection.
Yeah, makes your dietary efforts count for more.
So bringing it all together then, ferritin testing seems like a really simple but powerful tool. A way to get a handle on your health, potentially spotting issues early.
Exactly. It tackles those silent problems that can really impact how you feel day to day and your health long term.
So here's something to think about. If simple things like diet, maybe even adding more vitamin C, can significantly shift your iron levels, something so fundamental, what other straightforward daily choices might be quietly influencing other critical numbers inside your body right now without you even realizing it? Something to chew on.